Hi, let's see yet another NCLEX RN video based on care for the neonatal client. The nurse is teaching the mother of a newborn to develop her baby's sensory system. To further improve the infant's most developed sense, the nurse should instruct the mother to speak in a high-pitched voice to get the newborn's attention. Place the newborn about 12 inches from maternal face for best sight. Stroke the newborn's cheek with her nipple to direct the baby's mouth to nipple. Give infant formula with a sweetened taste to stimulate feeding. Currently, the sense of touch, it is believed to be the most highly developed sense at birth. It is probably for this reason that neonate responds well to touch. Auditory sense typically is relatively immature in the neonate, as evidenced by a neonate's selective response to the human voice. By 4 months, the neonate should turn his or her eyes and head towards a sound coming from behind. Visual sense tend to be relatively immature. At birth, visual acuity is estimated at approximately 20 by 100 to 20 by 150, but it improves rapidly during infancy and toddlerhood. Taste is well developed with a preference towards glucose. However, touch is more developed at birth. So here, to improve the infant's most developed sense, the nurse should instruct the mother to stroke the newborn's cheek with her nipple to direct the baby's mouth to nipple. While making a home visit to a primiparous client and her 3-day-old son, the nurse observes the mother changing the baby's disposable diaper. Before putting the clean diaper on the neonate, the mother begins to apply baby powder to the neonate's buttocks. Which of the following statements about baby powder should the nurse relate to the mother? It may cause pneumonia to develop. It helps prevent diaper rash. It keeps the diaper from adhering to the skin. It can result in allergies later in life. The nurse should inform the mother that baby powder can enter the neonate's lungs and result in pneumonia secondary to aspiration of the particles. The best prevention for diaper rash is frequent diaper changing and keeping the neonate skin dry. The new disposable diapers have moisture collecting materials and generally do not adhere to the skin unless the diaper becomes saturated. Typically, allergies are not associated with the use of a baby powder in neonates. So here we need to tell the powder can cause pneumonia. After teaching a new mother about the care of a neonate after circumcision with a Gomco clamp, which of the following statements by the mother indicates to the nurse that the mother needs additional instructions? The petroleum gauze may fall off into the diaper. A few drops of blood oozing from the site is normal. I will leave the gauze in place for 24 hours. I will remove any yellowish crusting gently with water. The mother needs further instruction when she says that a yellowish crust should be removed with water. The yellowish crust is normal and indicates scar formation at the site. It should not be removed because to do so it might cause increased bleeding. The petroleum gauze prevents the diaper from sticking to the circumcision site and it may fall off in the diaper. If this occurs, the mother should not attempt to replace it but should simply apply plain petroleum jelly to the site. The gauze should be left in place for 24 hours and the mother should continue to apply petroleum jelly with each diaper change for 48 hours after the procedure. A few drops of oozing blood is normal, but if the amount is greater than a few drops, the mother should apply pressure and contact the physician. Any bleeding after the first day should be reported. After completing discharge instruction for a primary-paras client who is bottle feeding her term neonate, the nurse determines that the mother understands the instructions when the mother says that she should contact the pediatrician if the neonate exhibit which of the following: ability to fall asleep easily after each feeding, spitting up of a tablespoon of formula after feeding, passage of a liquid stool with a watery ring, production of 1 to 2 light brown stools daily. The mother demonstrates understanding of the discharge instruction when she says that she should contact the pediatrician if the baby has a liquid stool with a watery ring because that indicates diarrhea. Infants can become dehydrated very quickly and frequent diarrhea can result in dehydration. Normally, babies fall asleep easily after a feeding because they are satisfied and content. Spitting up a tablespoon of formula, that is normal. However, projectile or forceful vomiting in large amounts should be reported. Bottle feeding infants typically pass 1 to 2 light brown stools each day. The nurse instructs a primary-paras client about bottle feeding her neonate. Which of the following demonstrate that the mother has understood the nurse's instructions? Placing the neonate on his back after the feeding, bubbling the baby after 1 ounce of formula, putting 3/4 of the bottle nipple into the baby's mouth, pointing the nipple towards the neonate's palate. Placing the neonate on his back after the feeding is recommended to minimize the risk for sudden infant death syndrome. Placing the neonate on the abdomen after feeding has been associated with this SIDS or sudden infant death syndrome. The mother should bubble or burp the baby after half ounce of formula have been taken and then again when the baby is finished. Waiting until the baby has eaten 1 ounce of formula can lead to regurgitation. The entire nipple should be placed on the top of baby's tongue and into the mouth to prevent excessive air from being swallowed. The nipple is pointed directly into the mouth, not towards the neonate's palate, to provide adequate sucking. So here, when the mother says placing the neonate on his back after the feeding, that demonstrates her understanding. After circumcision with a plastibell, the nurse should instruct the neonate's mother to cleanse the circumcision site with which of the following: antibacterial soap, warm water, povidone iodine solution, diluted hydrogen peroxide. After circumcision with a plastibell, the most commonly recommended procedure is to clean the circumcision site with warm water with each diaper change. Other treatments are necessary only if complications such as an infection develop. Antimicrobial or antibacterial soap or diluted hydrogen peroxide may cause pain and is not recommended. Povidone iodine solution may cause stinging and burning and therefore its use is not recommended. Approximately 90 minutes after birth, the nurse should encourage the mother of a term neonate to do which of the following: feed the neonate, allow the neonate to sleep, get to know the neonate, change the neonate's diaper. As part of the neonate's physiological adaptation to birth, at 90 minutes after birth, the neonate typically is in the rest or sleep phase. During this time, the heart and the respiratory rate slow and the neonate sleeps, unresponsive to stimuli. At this time, the mother should rest and allow the neonate to sleep. Feeding should be given between the first period of reactivity, considered the first 30 minutes after birth. During this period, the neonate's respirations and heart rate are elevated. Getting to know the neonate typically occurs within the first hour after birth and then when the neonate is awake and during feedings. Changing the neonate's diaper can occur at any time, but at 90 minutes after birth, the neonate is usually in a deep sleep, unresponsive, and probably hasn't passed any meconium. Hope you understood this video. Thanks for watching. Keep watching.